So challenges, Medicaid expansion, as I mentioned, I'll be interested to see, some of you, what will happen with that. Threats to our nonprofit status, there's been some discussion down in Boise about that. If Medicaid expansion happens, then you don't need to not have a nonprofit status. My viewpoint is that doesn't solve everybody. That there is still, at Gritman, we have about 5 to 7% of our revenues come from people that are self-insured, and even the gap coverage isn't covering that. And then the potential of Obamacare changes, that's obviously continuing to be in the papers. We don't know what that's going to look like. So the services, so neurology, what you will see is come July 1, neurology will be up in one of our medical office buildings behind Walmart until we build out that space. Pulmonology will be probably putting over at Moscow Family Medicine right across the street, and then oncology on the second floor. We are having other strategies to continue to recruit primary care, because that is obviously the access point. We're looking at endocrinology. That is another service that we continue to hear. Those physicians are very difficult to find. They're kind of like a unicorn. So we're hoping to recruit an endocrinologist here. And then there's a vascular surgeon that has an interest in doing some stuff down in our community. So we're working with him to see what that could look like. As far as partnerships, flu specialties, neurology was kind of last on our list. So now we'll be reaching out to the communities, to our medical staff on what other services make sense to come under that entity. So we'll be looking at that. Kootenai Health is another partner that we've worked with on trying to get services. So how to bring more specialists down here. And as I mentioned, recruiting another general surgeon. That's all I have.
On the medical building above Walmart, is it filled to capacity, or is there room for growth there?
So there's essentially 3 buildings that Gritman owns. So where Quick Care is, that building is what we call medical office building number 2, that is completely filled. Medical office building number 1, which is right across the parking lot from our ASC, that's where our neurologist will be. And we have shelf space of about 3,500 square feet in that building, so that's attractive to us. And then right across the street where flu surgeons is, that building is pretty much full. There's about 1,800 square feet of shelf space. The challenge with 1,800 square feet is usually you don't recruit a doctor, and if you have 2, you need about 2,500. So we haven't expanded in that, but we do have some capability to do that. Space is always my challenge in there, especially when we're recruiting services.
Do you see nurse practitioners as helping with the physician shortage? And I didn't see that talked about a whole lot. I saw some.
Yeah, so we've recruited, let me see if I can go back to my.
Oh, you don't have to go back.
We do, and we continue. So all of our clinics, we mainly have nurse practitioners or physician assistants. I can tell you Moscow Family Medicine over the last 10 years has started to recruit more of that. Our internal medicine clinic, we added a nurse practitioner in there that helps from a patient piece, because they are going to be a way to help with that access side in there.
What does it take to create residency programs? Like what, I mean, it's probably a really complicated question, but.
It is a very complicated. We actually looked at what's called a role training track to do that here. It is a federal program, so that's where your complication, if you remember my slide back there, where we would have to have an urban site, and be able to find an urban site has been our challenge in there. And then funding. They're very expensive to put in. Kootenai put in a residency program. They have 6 seats, and it's costing the hospital quite a bit to have that program. So that's the challenge that you have is a cost. But there is some stuff happening down in Boise to help get some more GME funding for it. So hopefully that will happen in our state. Yes?
So the new WAMI education building that's on Sweet Avenue.
Sweet Avenue?
Yeah. How will that affect the classroom space that's in
In ours?
Yeah.
So
How do those fit together?
And so WAMI, and if you followed the WAMI program, obviously WSU had students and they were sharing space between both universities. When WSU moved their students up to their Spokane site and then went into a medical school, that really changed it for the University of Idaho, where they essentially had leases that they had to address that space. So WAMI came to us when we were building our building to say, hey, we need some space. They needed 25,000 square feet. Again, if I would have known that, I would have built 4 floors versus 3 floors, because we could have done that. And so between that building and our building, it gets them to the 25. The building on Sweet Avenue is mainly classrooms. The anatomy lab is what's in ours.
You mentioned the Providence relationship with the stroke
Mhm.
evaluation program, but what's the role of telemedicine in Gritman's strategic plan?
We've tried to do some in telemedicine. The challenge that we run into, and it's changed in our state, is reimbursement. Back about 3 years ago, you could get some reimbursement. A lot of the payers weren't recognizing it, so that's where the challenge was. We have equipment, and it's great. The other challenge is patients. They don't find it as friendly as having a provider in front of them. So we've done it with mental health. So we had a program before we recruited Dr. Waite. We actually had a program with the Boise hospitals to do that. But we got rid of that because we had a lot of no-shows in that program. But we'll be looking at that because with the physician shortage and having a partnership, there still needs to be some legal stuff regarding licenses and credentialing, especially from different states that have to be addressed, but we'll be continuing to look at that because that is a way to bring services here. And there's certain areas where they do it. Dermatology is actually an easier one to do via telemedicine. Any other questions or anything else?
So the psychiatric services now, you're bringing in a psychiatrist, are they here
Yep.
already?
Yep.
And are we doing pediatric psychiatry?
Yeah, so there's two, and I think I skipped over that. Dr. Waite is one of our psychiatrists. He actually joined us. He was up in Coeur d'Alene. So he joined us last year about this time. And then Dr. Germain, she specializes in kids up to age 12 or anyone over 75. That's kind of her specialty. But she comes up once a month. And she has a program that she did in Grangeville, where she really works closely with those counselors in the schools. And so we set up a very similar program here, working with her to bring those services in. So we have a little bit of a gap between ages 13 and 17 that we're trying to fill. A little bit of a gap, but better than we were, I would say, 2 years ago. That's a challenging industry. But one of the things that we are talking about, some of you might have seen some articles about the U of I, and Dr. Cohn retired and they had a nurse practitioner. She just left, so we're working with the U of I and having some of the discussion is, what does behavioral look like in our community? And how do we improve that? Because it's fragmented. Healthcare, in my opinion, is fragmented anyway. And so how do we address those pieces and come together? So we'll be working on that. So if you wonder what I do, those are some.
Are you looking to become a center of expertise in any particular health area?
I'm assuming you're referring to Pullman and their centers of excellence a little bit, maybe?
Well, I wasn't thinking of Pullman
Okay.
in particular, but Spokane has a lot of heart
Yep.
focus, and I think Kootenai has another focus,
Yes.
I can't remember which.
So some of those programs are under different regulations. So one of the things, so we get accredited by a company called Joint Commission. We've been accredited under the Joint Commission for a number of years. So they do have programs that you can get centers of excellence under. They're expensive. You have to have the volume to do that. And so that's where the challenge comes in for hospitals. So yes, we've looked at those programs. Blue Cross also has certain programs too that they're designating in there. Our viewpoint is a lot of the initiatives, so you can actually, as a patient, part of that quality score, you can actually go see how hospitals are doing. All you have to do is go under a website, hospital compare, you can look up any hospital in the US, and see how well they're doing. The challenge for Gritman and a lot of small hospitals is we don't have the volume on some of those. And so what you'll see is NA, because we don't have it. Now, the other challenge is you might have, let's say, for one of the initiatives, we have 2 patients that come in. Well, we do everything we need to do on the one, the other one, we didn't timestamp something, you can't count it. So for us, then all of a sudden, we're at 50%. So that is the challenge for smaller hospitals too, from a volume standpoint. So we look at those programs if they make sense. Obviously, our goal is to provide high quality, that's the expectation. That would be my expectation if I went into any hospital. So we're not tracing those designations, we try to do it by, that is why we're here as a hospital.
Anything else? Any more questions?
One other thing I think is such a nice addition to Gritman is the chaplaincy program that just started.
Yep.
And I just find that to be a nice way to relate to the community, a compassionate reaching out to people, and I've heard good things about it.
Yes, I have too.
Yeah.
There's a lot of great things, it's really hard to narrow it down and talk about everything that we're doing in the hospital. But
And the other thing is that we're very grateful for, and Family Promise is the very reasonable cost that we're renting that building from Gritman for our day center. And that is a critical part of Family Promise, so that is so appreciated.
of course.
Yes, I have another question. What's your relationship with hospice these days?
Not as much as we would like. Home health and hospice are challenging, I would say, not just here in Moscow, but in the US. And a lot of that is to do with reimbursement. So we do have some services. We have some funds, actually, that were raised when we had hospice of the blues. Unfortunately, we don't have the mechanism or the entity to provide some of those services here. We have some, but it is challenging. But we do have funds that are essentially designated specifically for hospice. But that is one thing we were talking about is home health and hospice of the blues, because it's changed in the 25 years I've been at the hospital. So I don't have a great answer on that one, but we are looking at it and seeing how we can get back involved with it.
Any other questions? Well, thank you very much, Carol.
Thank you.
Very